Still too early to say that vaccines are making a big difference, but we already see some good signs that vaccines are reducing death among people who have been covered before. We're seeing hospitals that were generally receiving cases, severe cases from mainly the city of Kigali. Nowadays, you're seeing transfers from other districts. That's why we are trying to cover also those districts as quick as possible with vaccines we have. So basically, the effect of vaccine to reduce severe cases and mortality is being observed for the ones we've covered before. But it's still really early to say that the impact of vaccine nationwide has been attained. We continue to see the changes, not yet the transmissions, but on the severity of the disease and mortality, we see the impact in many ways.
Certainly good news. Some of the recent developments show that booster shots are now being given in other countries rather. How do you interpret this, and will we need booster shots in Rwanda as well?
Yeah, the virus is changing itself. We've seen at least 4 major changes of these vaccines, normally called variants. Virus changes itself every single day, but in general, there are minor changes that make it even weaker than stronger. But like the example of Delta variant has been that this virus can even become more severe and more dangerous. So having a 3rd dose will probably bring the vaccine efficacy even higher than what it was last year, when most of the vaccines were tested on a virus that was not yet mutating. Now, the virus has mutated. So the vaccine is being tested on another type of virus that adding a dose makes it even more efficacious to the virus. But a 3rd dose should not be, to me, should not be a problem, because it's not the first time. For COVID, I believe that a 3rd dose is going to be necessary if the virus keeps changing, so that we can have a stronger and longer protection. So I don't see it as a problem. I see it as a normal ways of boosting our immune system, our defense system. Hopefully, the virus will be weaker and people will keep the measures and we don't need another dose, or we vaccinate more people. But if not, a 3rd dose is a normal way of keeping us stronger against the virus.
Okay, I guess we'll just have to brace our arms. Well, as we perhaps wind up, let's talk about long COVID. We've seen people across the world say they've experienced symptoms way after they've tested negative for COVID-19, and I believe there's still much to understand, but what is not understood should also not be ignored, right? What do you have to say about long COVID, and do you have any research being conducted in Rwanda here?
Yeah, absolutely. We're following up on people who have recovered from COVID-19 since last year. Generally, with the previous virus, it was not that much severe. With Delta, we see a lot of damages in the lungs that people are suffering even after testing negative. There are general symptoms that people who recovered have been presenting, depending on the level of severity they went through. Those who have been on oxygen for a long time, who have been having or living with symptoms for a really long time, even if they didn't go to oxygen. Generally, the virus destroys the lung cells, and recovering is a challenge and sometimes not reversible. The issue of COVID consequences that are affecting people who have recovered from COVID-19 is becoming another kind of pandemic that we may be facing for those who have been affected by this virus. That's where the vaccine comes in as an important protecting factor, that those who took the vaccine, even if they get some severe symptoms, the damages to the lungs are totally different from the damages without a vaccine. But long COVID is a serious challenge for clinicians. We've been having people who recovered from our treatment centers who are coming back in the hospital because their lungs are not able to continue to supply the oxygen as they should. And they need also oxygen support, and yet they are not COVID positive. Now, we've seen cases of people who are having fatigue for several months after recovering from COVID-19, who are losing
some hearing,
even the hearing, even the
hearing,
yeah, it's affected a lot of organs. There are not many, but we have cases. We are following since last year.
So we'll have to leave it at that for today, but thank you so much, Dr. Sabin Nsanzimana.
Thank you very much. Yeah.